Really warm welcome to Chief Exec Shout Out. This is the 5th in our series where we take each month an opportunity just to go around the hospital and meet different teams who all contribute to the magnificent place that is Derriford. So this month, I'm really pleased to be spending some time in intensive care unit with our teams here. So I'm really pleased to be joined by Peter and Danielle, and they've been absolutely at the leading edge of all of the work that's been going on. So Peter, just in terms of intensive care, we've clearly thought a lot and covered a lot of the work we've been doing with our COVID patients. But just tell me a little bit about our non-COVID patients and what's been going on in the unit there.
Well, certainly compared to the first wave where we had very, very little non-COVID work. Second time round, January, December going into January, we were very busy with our non-COVID work, and then COVID hit, so we had to increase our capacity by an extra 10 beds, which meant we moved all our green work upstairs to level 6 and had the whole of the Terence Lewis building on level 6, so 28 beds up there. That was our green stream, and that enabled us to have our red stream down here on level 4.
So just give me an idea, what sort of numbers of staff are involved? How do you keep patients really safe?
As we'd planned, we had on level 5 our store cupboard there was, I refer to it as our intensive care in a room. So we had 10 extra beds, literally all, not the beds, but we had the ventilators, the syringe drivers, the volumetric pumps. I think we also had 4 renal replacement machines up there. So we had everything we would need to escalate into 10 extra beds.
Equipment, but at the end of the day, it is just equipment, isn't it? And in a way, that's the easy bit. As you've said, it's the staff. And so, Danielle, if I can just turn to you, because staff continue to play such an important role in this last year, haven't they?
We had over 120 staff join us as part of the escalation staff, and they ranged from registered nurses to ODPs. We had healthcare assistants and some flexible support workers as well. We even had, towards the end, we had some third-year student nurses who joined us as aspirant nurses for 12 weeks. So a huge range of staff, huge range of skills and experience. We had some staff who returned to the area that used to work with us, and other staff that came with ICU experience. But the majority of them had never worked here before, and as you say, it's so intimidating coming onto ICU for the first time. A big part of our welcome was to put people at ease. It's incredible really, because every member of staff that came through those doors had a skill that they could offer and that was useful to us and helped.
I know from what I've heard, people have absolutely loved the experience, as well as it being, something that people will never forget. How might we use those staff in the future?
To be able to keep in touch and to call on them again. We saw over 300 staff in the first wave come through a Rise Up programme. It felt very different this time, and we didn't see any of those for the second wave. There was 120 new staff who hadn't been to ICU before. So to keep in touch with them and to be able to get them back if we see another wave, and also to keep their skills up to date. We're always happy to welcome them back on bank shifts, and we'd encourage them to as well.
That's great. Thank you both very much. And I think you can see both the work that's gone on in the department has been incredible, and it has been one great big team effort. I'm particularly pleased to be joined by 2 colleagues from our chaplaincy service. So welcome to Sasha and Janet. Now, most people probably think the chaplaincy service is just about faith and religion. Now, I know it's a lot more than that, but perhaps if I could ask you, just you describe what service is that you provide to our patients and to our staff.
We used to say religion is the last thing out of our toolbox, but I think we've evolved to a point where we're saying actually maybe there's no toolbox, because we're not about providing a structure or a framework, we're actually about providing a space that we create for people in which to pour their story. And so we are listeners, and that's at the very, very base of all that we do. So people can feel welcomed and listened to without any sense of us delivering something or having an agenda. And that's for staff and that's for patients and nurses.
You know, this last year's been so challenging. A lot of real beautiful nuggets of stories and good things that we'd want to take into the future. But how have you, give me some examples of how you've supported staff during this period?
I think moving on from the way in which we create space for people to tell their story, that's exactly what we've been doing and continued to do. I mean, right at the very beginning we thought, oh, what's it going to be like? How will we be used? And it's evolved really quite quickly into being that listening service.
I know how busy you've been in this last year supporting our patients, and they're a primary focus for us, supporting staff. But I think you've also found time to write a book and edit a book. So tell me about the book and what that's going to be about.
Well, it's just in addition to the space wellbeing stuff and our one-to-one with staff, which we do an awful lot of, so all of that's kind of our usual practice, both and. Our book is called Creating Space, the Practical Theology of Healthcare Chaplaincy. And really what that means, it's a personal and professional story about how the department has evolved in the last 10, 12 years.
We wanted to be able to share those discoveries because Derriford Chaplaincy is, dare I say, quite different in some ways. The ethos is different to what you might expect a traditional chaplaincy to have been over these years. And so we wanted to, share that and to extend that sense of this is another way of doing things and see what you think, try it out. So it's not just about our own hospital visitors, it's about members of staff, hospital staff who come and do our training when they want to learn better pastoral skills. It's about people outside of the hospital who visiting the community, and that training is now being extended out. So a sense of teaching people, again, not to deliver, but to offer a space.
And I think that sense of creating a space for people to talk, to be heard about where they are right now is something that could be applied to all of us. And I think, if anything, from this pandemic, what we want is that to be part of our story of Derriford as we move forward and we emerge stronger. So thank you both very much. Can't wait to read it. I also want to pay great applause really to our teams in both theatres, IM&T and the digital team. We've just introduced a new system called Bluespire, which is a digitally enabled system for theatres. And this really helps us make the most of the large number of theatres we've got, the staff that we've got, and making sure that we use all of that capacity really well to treat as many patients as we can. And I think now, as we look back over this last year, we can take a bit of time just to acknowledge what we've done, how far we've come, and how much we will still be capable of in the future by all working together. So thank you as always. You are the best team, and it's my great privilege to be your Chief Executive.